Hello, good afternoon. My name is Elita. I will be doing an assessment with Gabriel today. I will be doing head, eyes, ears, nose, and throat assessment. Okay, first, I'm going to start with the skin and the nails. First, I'm going to inspect the skin and also inspect the nails and also palpate the skin. Okay, let me see your nails. Okay, I'm going to pinch his skin. Okay, it's less than 2. Capillary ripple is less than 2. The skin is warm, warm to touch, pink, and the nails are without clubbing and no cyanosis. Now I'm going to check the head. The hair is very thick, coarse. I'm palpating for the head for any lumps or bumps. So far, no lumps and no bumps. Okay, next, I'm going to check his eyes. First, I'm going to inspect the eyes. There's no exudate. The sclera are white. I'm going to check the conjunctiva. The conjunctiva are pink. Next, I'm going to check the cranial nerve 2. I'm going to let him read the Snellen chart. I'm going to tell him to cover the left eye, and please read number 8 just above the red line.
DEFPOTEC.
Okay, good. That's cranial nerve 2. Next, I'm going to check cranial nerve 3, cranial nerve 4, and cranial nerve 6. First, I'm going to turn off the light, and I'm going to use my pen light. Okay. All right, good. Turn on the light. Okay, the pupils are equal, round, reactive to light, and accommodation. Next, what I'm gonna do is I'm going to use the ophthalmoscope. I'm going to check the optic nerve. I'm going to check his right eye. So, um, I want you to look straight. I'm gonna put the ophthalmoscope on my right eye, like 15-degree angle from him. And I'm going to go closer. Okay, I'm seeing the red light. Going closer, I'm going to adjust my ophthalmoscope. Okay, I see, I see the arteries. Okay. Next, what I'm gonna do is I'm going to check the 6 different cardinal views. I want you to follow my finger with your eyes only. Very good. Next, I'm going to look at my finger for convergence. Okay. Very good. Now I'm going to check the peripheral vision. Tell me when you could see my fingers, okay?
See him.
Okay.
See him. See him. See him.
Okay. Next, next I'm going to check the cranial nerve number 5. I'm going to use the I'm going to use the Q-tip. There are two sides on the Q-tip, the soft side and the sharp side. Okay, I'm going to check the forehead. Tell me if it's soft.
Soft.
Okay,
Soft. Hard. Sharp. Sharp.
the face,
Sharp. Sharp. Soft. Soft.
the mandible.
Sharp. Sharp. Soft. Soft.
Okay, so that's cranial nerve 5. And I want you to clench your teeth. Okay. Now I'm going to check the cranial nerve 7. I want you to smile. I want you to frown. Show me your teeth. Flap your mouth. Okay, I'm going to poke. Just poke. Okay. Close your eyes. Try to open the eyes. Okay. So all the cranial nerves are intact. Okay, now I'm going to check is ears. First, the pinna and the external ear, the tragus. If I press it, do you feel any pain?
No.
No. Okay, so the external ear looks clean. I'm going to check the internal ear using my otoscope. Okay, going to check your ears. I'm going to pull it backwards, up and backwards. Okay, there's some cerumen and the inside the tympanic membrane pearly white. Okay. Next, I'm going to check and see his hearing. I'm gonna whisper on his right ear. I'm going to try to close his ears and whisper 99. What did I say?
99.
Okay. Now I'm going to check for the Weber test. This is a tuning fork. I'm going to hit it and tell me you hear it?
I hear it.
Both?
Yes.
Okay. Now I'm going to check for the Rini test at the back of the ear. Tell me when you stop hearing it.
I stopped hearing
Okay. Now I'm going to put it on the ear.
it. Stopped hearing it.
Okay. So this is air conduction and the back is bone conduction. Air conduction should be longer than bone conduction. So far that's it. We're done with that. Next, I'm going to check his nose. First, I'm going to check the nose, symmetrical to the face, and then I'm going to check the mucous membrane of the nose. Okay, I'm gonna raise your nose. Okay, it's paint, and you also check for septal deviation. Okay, now I'm going to check the mouth. The lips first, check and see if there's any lesions, if there's any cracks, if there's uh, any any bumps on the mouth. Now I want you to open your mouth. Okay. Check for the tongue. I'm going to check the inside of the mouth, the cheeks, if there's any thrush or any lesions. Okay, and I'm going to tell him to say ah, open. Okay, and I'm going also to check the inside of the mouth. So far it's clean, and the dentition. I'm checking the dentition. Also for the checking for submandibular ducts too as well. Okay, so far so good. Now what I'm going to do is I'm going to palpate the lymph nodes on his neck. First is um, pre-auricular lymph node. I'm going to use my 2 to 3 fingers in round motion. This is pre-auricular, post-auricular. This is tonsillar, submandibular, submental. This is inferior clavicular, posterior clavicular. This is uh, supraclavicular, and this is occipital, the back of the head. Okay, so far I don't feel any lymph nodes. Now I'm also going to check the thyroid. Um, and then I just want to make sure that the trachea is midline. Okay, the trachea is midline. And I'm going to check the thyroid behind him. And I'm going to let you drink water. Okay, not yet. Okay, checking if the trachea is midline. Yeah, midline. Then I'm just going to check the 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 thyroid gland. Okay, can you drink water? Swallow. Okay. So far, thyroid gland are normal. They're not enlarged. Okay. So I think that concludes the tests um, for the head, for the head, the eyes, the ears, the nose, the throat, and the neck. So thank you very much and have a good night.